This paper is on osteoporotic fractures with neurodeficits in patients with more than age 70. Efficacy of short segment stabilization with cement augmented fenestrate pedicular screw system. So osteoporotic fractures often progress to neurological impairment and severe pain, which results in restriction of mobility in the elderly patients. Conventional open spinal decompression and stabilization in these patients have significant morbidities related to age, surgical approach, and blood loss. In this study, 45 patients aged more than 70 years or older who had osteoporotic vertebral fractures and with worsening back pain and neurological deficit were included in the study. Plain radiographs, MRI, CT scan of these patients were assessed. These patients underwent minimal invasive stabilization and cement augmented fenestrate pedicular screw fixation with vertebroplasty with or without decompression in the midline. Preoperative and postoperative ASIA score, VAS score, and Charlson's comorbidity index were recorded. Preoperative Cobb's angle, spinal alignment, spinal canal encroachment, anterior vertebral body height were recorded preoperatively and during each follow-up. So this is the rough technique. The junction needles were placed in the pedicles above and below the fracture. The guide wires were passed. Fenestrate screws were passed and the cement was injected through the screw. Vertebroplasty was done. If necessary, midline decompression was done. So this is an example, 78-year-old female with wheelchair-bound Asia C neurology, vacuum sign, local kyphosis, anterior vertebral height loss of greater than 50% and retropulsion. So all spine at risk signs positive in this patient. She had a lot of medical comorbidities, so we underwent MI stabilization and vertebroplasty, and she did recover well. Another patient, elderly patient with neurology, cement augmented stabilization 2 levels above and 2 levels below with midline decompression, since patient had almost grade 2 Pawar in both lower extremities. So similar patient, 84-year-old woman post CAPG with D12 fracture and Asia C neurology underwent same technique with good results. So all patients neurologically recovered. The VAS score significantly improved from average 9 to almost 2 post-operatively and 1 at final follow-up. An average local angle of kyphosis was 15 degrees preoperatively, which decreased to 7 postoperatively. The anterior vertebral body height was 11 millimeters, which increased to 22 millimeters postoperatively. No revision was required due to screw loosening or failure of the construct. So we conclude that patients with osteoporotic vertebral fractures with neurodeficit in patients who are 70 plus years of age, short segment stabilization with cement augmented pedicular screws and vertebroplasty is associated with good clinical outcomes. Thank you.